I started out as a computer engineer before going to law school. You have worked to extend broadband internet service in Vermont, and on your website you say that as governor you will expand broadband to every last mile by 2012. I live in downtown Burlington and I still don't have broadband. What do you think about Burlington Telecom and its financial problems?
Well, let me tell you that first, I'm always a politician that will just tell you exactly like it is. And since the legislature adjourned, I've been spending a lot of time with really smart people putting together a plan to get telecom to the end of every dirt road as fast as we can. And they're all telling me it's 2013, Peter, not 2012. So I'm going to sneak a little bit on your date to 2013, and we're going to change it on the website. Okay. Having said that, just in interest of accuracy, I am going to be the governor who does for broadband and cell service what my favorite Vermont Governor George Aiken did for electricity. George Aiken insisted with the power companies when they wanted back in the 1920s and 30s to only run power to the profitable markets like Burlington and Brattleboro and Barrie, the big population basis. Instead, he said to the power companies, no, it's not going to work that way. You're going to run that power to Mrs. Murphy at the end of the dirt road if you're going to run power anywhere. And that's the kind of commitment we need, because broadband is the electricity of yesterday. It is absolutely critical to our economic development, and we have to get it done. Having said that, I think Burlington Telecom is a good model that had two arms tied behind their back when they went into business. And let me tell you what I mean by that. The notion of community ownership makes sense, of public ownership of entities like internet, because you control your own destiny. Instead of having a Comcast or what was that last bunch of crooks, Adelphi, that went to jail for ripping off the public, you know that your own entities are in control of what you have to get done. The problem with Burlington Telecom and for Burlington Telecom is that when they set up, and I was in the legislature there and we kind of all slept through this, the Comcast and Adelphi, who were still around then, came in and said, okay, we don't mind this little Burlington Telecom thing happening, but we don't want them to compete with us, so they can't borrow money. They cannot bond for, they can have no debt. They can't bond for money. And that's insane. I mean, imagine if Adelphi or Comcast, now Adelphi's gone, but any of these big telecom companies in America couldn't borrow a cent. They wouldn't exist. So I, as governor, will put together the most aggressive public partnership that we've ever seen, using some bonded dollars and as well as private sector dollars to deliver on the promise of fiber and high speed to the end of every dirt road. We've got to get it done. And the fact that you don't have it in downtown Burlington, we don't have it in downtown parts of downtown Brattleboro, it's insane. And we've got to get it done.
I'm looking forward to getting broadband.
Well, we'll get it for you.
Good. I just got my first hunting license last year. I understand that you are also a hunter. Where do you go hunting besides your own farmland, and what kind of game do you go after?
Well, I'll hunt anywhere that anyone will take me. I've hunted in Montana. I've hunted in different parts of the country, but the place I like to hunt most is my own farm, just because I know it so well. I know exactly where the deer run. I used to hunt a lot of birds, but I'm primarily a deer hunter, and I love being in the woods. I love the idea of gathering my own food. I love gardening, by the way. I raise pigs and sheep, and I've raised just about everything that you can eat in my lifetime. Obviously, I raise a lot of beef. But I'm a big believer in growing local and eating local, and that keeps you healthy. And obviously, there's no better meat than venison.
You like the deer meat better than the beef?
I actually do.
Yeah.
It's leaner.
On the national scene, the Democrats have generally favored restrictive gun control laws, while Republicans have generally opposed them. Vermont, as a generally rural and sparsely populated state, has had a liberal attitude to gun ownership. What is your position on gun control? Are you a member of the NRA?
I'm not a member of the NRA, but I feel strongly that we have all the gun laws that we need in Vermont. And I just don't see it as a problem. I'm not someone that seeks solutions to problems that don't exist. Now, if I were a member of Congress from Manhattan or downtown Chicago or downtown LA, I might look at this very differently. But we are regional, and I'm an urban kid. I'm not an urban kid. I'm a rural boy. And, you know, I just don't see too many people in Vermont going around shooting at each other. I don't think it's a problem.
Yeah, we have less crime in Vermont than anywhere else in the country.
That's right, and the crime that we do have is mostly drug and alcohol related, and I think that we have to find better ways to treat Vermonters that are addicted to alcohol and drugs, but that will help solve many more problems than putting further control on guns in this small rural state.
In the Senate, you have worked to provide health care for every Vermonter. Many Vermonters believe that health care should be regarded as a basic human right. I lived in Canada for a couple of years where health care really is available to everyone free of charge. What do you think about the Canadian single-payer health care system?
Well, I'll tell you how I've evolved on health care. When I first went to the legislature, I worked with Howard Dean and others to do piecemeal health care reform, and some of it's been quite good. I'm proud of the fact that I worked together with the governor to pass Dr. Dinosaur, the first state in the country to ensure that every single child has health insurance. Of course, those are the cheap ones to insure, but we got it done. We've made some expansions to the existing health care systems and insurance programs. The problem is that they're unaffordable, that they've never been properly funded, and that when you make a piecemeal surgical legislative change to the healthcare system, all you really tend to do is change around who's paying, but you don't solve the real problem. And the real problem in Vermont isn't really access, because we actually have one of the best healthcare systems of any state in the country. When you go to your doctor, your primary care provider, whoever it is, they're great. They do a great job. Their biggest problem is they got a bunch of insurance companies and bureaucrats breathing down their backs, telling them what forms to fill out and what they have to prove before they fix you. That's really their biggest challenge. So the conclusion that I've come to is our problem is cost. We are now spending $1 million more a day on health care every single day in Vermont than we were the day before. This little teeny population of 600,000 people, $1 million a day. I mean, that's a lot of money. So my feeling is we need to pass the first single-payer health care system in the country. I will get it done as governor, and it will have the following components in it. Health insurance will follow the individual, not be a burden of the employer. That in itself will be a huge jobs creator. Imagine that the little state of Vermont, in cooperation with the federal government, can be the first state where insurance follows you, not a burden of the employer. It's one of my biggest challenges, and most of us that are in business, is providing insurance to our employees. Now, no one asks me to cover the fire insurance for my employees on their house. No one asks me to cover their life insurance. No one asks me to cover their automobile insurance. Why I'm covering their health insurance has happened for lots of reasons that don't make sense. So let's develop a system that's financed by each of us and follows us individually. Second, let's pass a system, first in the country, where our hospitals are reimbursed based upon the outcomes of their procedures, not how many tests they run you through. That'll save a huge amount of money. I shouldn't use my dad as an example, but I will. He's 85. About once a year he decides that he has pancreatic cancer, usually from an ulcer, because he has an ulcer. But he gets in his head that's what it is. So he goes down to the hospital and they run him through the tests, the whole gamut. And he comes out and indeed he's survived pancreatic cancer once again. He doesn't have pancreatic cancer. But this has happened a number of times. Now, any good medical system would say, wow, we're looking at your records. Actually, we did these tests a few years ago. You have chronic ulcers at this time of year, and this is how you treat them. Why does the hospital do that? They don't do it because they don't know better. They do it because it's usually Brattleboro Hospital. Just up the road 12 miles is Grace Hodge Hospital. They've got their own MRI machine. Just 20 miles down the road in Greenfield, Mass., who Brattleboro competes with, they've got their MRI machine. You can go halfway across the Connecticut River to Keene, New Hampshire, Dartmouth affiliate. They have their own MRI machine. And if you really get sick, you go up to Dartmouth, where they have multiple MRI machines. The point is, Those hospitals have to run those machines to pay their bills, and guess who's paying for it? All of us. So pay providers based upon their success of keeping you healthy. And there's a lot of work being done on that. Vermont can be the first state to do it.